Interdisciplinary bedside rounds, a strategy to improve patient care and patient flow. The objective of this video is to provide an overview of interdisciplinary bedside rounding. We will explain the main components and benefits of interdisciplinary rounding, how it puts patients and their families at the center of care decisions, and how interdisciplinary rounding differs from the more traditional types of rounding used on most inpatient units. Long waits in the emergency department and elsewhere in hospital are a symptom of complex problems affecting patient flow at many other points in the health system. One factor contributing to poor patient flow and lengthy hospital stays is the challenge of coordinating care between many different healthcare services and providers. A specific type of bedside rounding, called interdisciplinary rounding, can help improve coordination and communication and make care more patient and family-centered. So what do we mean by daily interdisciplinary bedside rounds? Interdisciplinary rounding is a process that brings together a patient, her family, and the health providers involved in her care to develop and review the patient's care plan, determine what is required to help the patient achieve her goals for each day and overall hospital stay, and prepare for her transition to home or to the next phase in her care journey. Interdisciplinary rounding ensures that patients and families are at the center of care decisions and information sharing. What's different for patients, families, and providers? With traditional forms of rounding, such as multidisciplinary rounding, discussions about care planning don't always involve patients or families. Typically, with multidisciplinary care, several professionals provide care to a patient, but they often work independently from each other. As a result, multidisciplinary rounds tend to involve mostly information sharing, with each provider focusing on the specific treatment he is providing to the patient. This makes it difficult to develop an integrated plan that is based on what's most important to a patient. It also leaves patients and families, and some providers, in the dark about the care plan. In contrast, interdisciplinary care ensures more collaboration between different members of the team. Teams integrate the knowledge and expertise of each member, including patients and their family, to find solutions to complex problems and work towards shared goals. Interdisciplinary rounding provides a forum for team members to ask questions of each other and explore options in partnership with patients to achieve the best possible health outcomes. Although interdisciplinary rounds is considered a best practice for delivering inpatient care that is patient and family-centered, there is wide variation in how the approach is currently being applied in Saskatchewan hospitals. Adopting this type of rounding province-wide will ensure all patients and families are actively engaged in care planning and that there is regular communication amongst team members and the patient and family. Effective interdisciplinary rounds include the following key elements. Patients and families are at the center of all discussions and decisions about their care. The philosophy of nothing about me without me. All team members involved in a patient's care participate in care discussions. This includes physicians, nurses, and other allied health providers, such as physiotherapists, occupational therapists, and social workers. There is a standard process and time for rounds, so patients, families, and staff know when the meeting will take place and what to expect. All care team members work collaboratively to achieve a patient's care goals. Interdisciplinary rounding gives patients, families, physicians, and care teams a scheduled, consistent forum in which to respectfully share information and collaboratively make care decisions. It also ensures patients are getting the right care to meet their needs at the right time and in the right place. Research suggests that there are many quantifiable benefits to effective team rounding with patients and families, including shorter lengths of stay, fewer delays in discharging patients and improved transition planning, fewer errors and adverse events, and better teamwork and improved satisfaction for patients, families, and staff. Evidence also suggests that interdisciplinary rounds can reduce the risk of hospital-associated disability, particularly among older adults. Many units across Saskatchewan have been making great progress with interdisciplinary rounding, and they're already starting to see some of these benefits. Hospital-associated disability is the loss of a patient's ability to do everyday activities such as walking, eating, bathing, and dressing. Frail seniors are at highest risk for this type of disability. Studies suggest that it occurs in more than a third of seniors with hospital stays. Even when patients' medical needs are being met in hospital, they can still experience a decline in their ability to perform routine activities. They may leave hospital with a new or worsened disability, which might mean they can't live independently. Many aspects of a hospital stay can contribute to this decline, including reduced or restricted mobility due to prolonged bed rest, decreased nutritional intake, and an unfamiliar environment. Teams can prevent or minimize this decline by focusing on back-to-basics care and incorporating safety checks into their daily rounding processes. What are back-to-basics care and safety checks? Back-to-basics care requires everyone on the team to have a common understanding of a patient's status before he was admitted to hospital and his goals for care and discharge. Interdisciplinary rounding provides a framework for all care providers to work toward a common set of goals for the patient and to maintain or improve his functioning. The main elements of back-to-basics care are mobility, pain management, nutritional intake, bladder and bowel output, and supporting patients to perform daily activities. How could this be incorporated into daily rounding? Let's take mobility as an example. The team could determine, in consultation with the patient and their family, when they can safely walk on their own and whether or not they need a walking aid, such as a cane. Team members would then hold each other accountable for ensuring everyone is doing their part to prevent injury and loss of independence. Incorporating safety checks into discussions at daily rounds allows teams to review any safety concerns that have been identified, then take the necessary steps to prevent problems from occurring. When patients leave hospital, it is important to ensure there's been adequate communication and preparation, and that everything is in place at home, including equipment, medication, and support from family members or community service providers. Incorporating transition planning into daily rounds provides patients and families and care team members ample time to plan for the transition and creates a framework for everyone to work together toward a common goal and address any potential barriers. Discussing transition planning as part of interdisciplinary rounding helps get patients back to their home environment and support networks as soon as it is safe to do so. There is growing evidence that effective interdisciplinary care improves patient care and outcomes. Adopting interdisciplinary rounding province-wide will improve communication and help teams meet the increasingly more complex care needs of patients. It will give people a similar standard of patient and family-centered care wherever they visit a hospital in the province. And it will help ensure patients receive the care that best meets their needs in the right place at the right time. For more information about interdisciplinary rounding, download the Patient Flow Toolkit at hqc.sk.ca.